The aim of this video is to educate expectant parents on keeping a healthy pregnancy. First, congratulations on your pregnancy. I'm Dr. Yusuf Al-Yusuf, a gynecologist and fertility specialist. And today, I want to share some practical tips to help you maintain a healthy pregnancy and give your baby the best start in life. Let's cover some prenatal care essentials. We suggest that you continue taking your prenatal vitamins such as folic acid or folate or any other general prenatal supplements, at least for the first 3 months. There are some supplements that you can take throughout pregnancy as well as breastfeeding. Exercise regularly because staying active during pregnancy is highly beneficial. You can aim for 30 minutes of moderate exercise most days of the week. This could include walking, swimming, prenatal yoga, or even Kegel exercises. These activities can help improve your mood, maintain a healthy weight, and prepare your body for labor. But remember, always consult your healthcare provider before starting any new exercise routine. And always attend your scheduled checkups. This could be with your obstetrician, GP, or your midwife. It might include essential scans or blood tests to ensure your health and the health of your baby. Some of these tests might be first trimester screening, which is a combined blood test and an ultrasound scan. This is to assess the risk of chromosomal abnormalities, such as Down syndrome or similar conditions. You can also have another test called NIPT or NIPT, non-invasive prenatal test. This is a simple blood test on mom, and it is to screen for genetic conditions such as Down syndrome and similar conditions. This can be done from 10 weeks gestation. Next, you might consider having an anatomy scan, which is highly recommended. This is to be done around 20 weeks gestation. This is a detailed ultrasound scan to check your baby's physical development and as well as the development of major organs. At the end of the second trimester or beginning of the third trimester, it is also recommended that you do gestational diabetes screening, sometimes called glucose tolerance test. Most commonly performed between 24 to 28 weeks, and this is to check for diabetes during pregnancy. It might be done sooner if you have risk factors, such as prior history of gestational diabetes, family history of diabetes, or if you're overweight. You might also have some additional ultrasound scans to monitor your baby's growth or amniotic fluid, particularly if there are any concerns about baby's growth or other complications during your pregnancy. For example, high blood pressure, gestational diabetes, or preeclampsia. It can also be used to check the position of the placenta if the placenta was low-lying. Now let's move to some dietary recommendations. You can focus on nutrient-rich foods. You can eat colorful vegetables and fruits, lean proteins, and whole grains. Incorporate dishes that are rich in nutrients and safe during pregnancy, such as lentil soup, baked fish, grilled meats, chickpea salads, fattoush, tabbouleh, and lightly spiced stews. These options can provide essential vitamins and nutrients. And for fats, include healthy fats from sources such as avocados and nuts. And there are some foods to avoid too, such as raw or undercooked meat, high mercury fish, and unpasteurized dairy products. And for caffeine, limit your coffee intake to 1 or 2 cups per day. But remember that tea and some soft drinks also contain caffeine. And now to some lifestyle tips. It is really important to avoid alcohol, recreational drugs, and smoking. This includes secondhand smoking. This is really important for your health and the health of your unborn child. And let's not forget about your emotional well-being. You can practice relaxation techniques, spend time with your family, friends, and your loved ones. And finally, a healthy pregnancy is a shared journey between you, your family, and your healthcare team. If you have any questions or concerns, don't hesitate to reach out to your care team. Wishing you and your baby good health, happiness, and a smooth pregnancy ahead.